At the time, I was doing a lot of analyses on the back end of a lot of surgical studies. And we were finding that the sponsored studies, the devices that were sponsored, were having an effect that was greater than the comparator. And my thought was, I said, tell me about this device. What's really different about it? Why are we seeing a difference in clinical outcomes, which is quite a complex topic, right? Function and a person's pain experience, specifically pain intensity. How in the world is that influenced by a device type? And then we realized that it probably wasn't that. And we looked into the literature, and there have been people talking about equipoise for some time. And the clinical equipoise piece this is where, if you do a randomized trial, you really should have two groups or two comparators that one isn't known to be different than the other. You expect the two to be very similar. If you go into a study expecting one to be markedly different, then you are going to have bias toward that, which will improve it. And the other one was the biggest one. And it was based on a lot of the studies at the time that were going on where people were comparing manipulation versus mobilization. And they were big advocates of manipulation and they didn't believe in mobilization. Or it was McKinsey versus non-McKinsey. And then people were huge advocates of McKinsey, and the comparison was some garbage intervention. And that is a lack of personal equipoise. So the clinician basically has an assumption going in that one is going to be better. So what we did is we measured it in our study. We had 18 PTs that actually delivered the care in the RCT. And before the study began, we actually found out where they were on a spectrum. Are you pro-mobilization? Are you pro-manipulation? And if so, what is the effect? How strong are you pro or con on that? And then we calculated that versus the outcomes at discharge. And we actually found it was a pretty noticeable effect, that those who were pro-manipulation actually had outcomes that were better with manipulation because they did both interventions. And then those that were pro-mobilization had better outcomes with mobilization than manipulation. And it was an eye-opener. And I thought, okay, maybe this is an anomaly. And then Mark Bishop's group out of University of Florida did a follow-up study. Guys, I remember meeting him it was at a bar, but we weren't drinking. We were just talking about the study. And he said, I think I'm going to embed that in my study. And he found the exact same thing. So it was wonderful to see externally somebody else found that. I think it's part of that whole contextual component, right? Contextual factors, all of those extra therapeutic elements that are really hard to measure, but we know influence outcomes quite a bit.